Hey guys, today I have Dr. Neeraj J from Bangalore Medical College, who was my batchmate uh, in Bangalore Medical College. He secured an All India rank of 350 in the NEET PG 2025, and very big congratulations to you, Dr. Neeraj.
Yeah, thank you, Vaibhav. Glad to be here, and congrats to you too as well. Hope to see you as my colleague on the other side in like wherever we go. So yeah, glad to be here. And let's hopefully like a lot of people can learn from what we have to say today.
Yes. Okay, Neeraj. Before coming to your journey of this NEET PG preparation and all, please share your experience about your UG life, basically our UG life.
So yeah, like I mean, I was your not exactly your usual localite student, but yeah, I mean, I always enjoyed like reading what we had. So it's like not all of us enter MBBS, thinking like purely like, oh no, this is what we want to do and we want to become doctors and all of that. But gradually, it sort of rubs off on all of us. So I sort of enjoyed the whole process of learning all different subjects and like yeah. So like in my like from I mean, first year is obviously a little tough for everyone to transition like when you finish your 12th grade, but then it's always like I sort of enjoyed reading those clinical scenarios, and and I was never the type who read purely for an exam purpose. So it's like I was always the kind of person who was like, okay, one reading of textbook should be there regardless of whether it's something that will come in the exam or not. And I'm glad because that sort of approach helped helped me over the long run as well. And so yeah, that was pretty much about it. And over the way, like reading different subjects, it's like you sort of realize what you have a passion for along the way. So for me, like along the way, reading subjects like when I was in final year, when I began reading Harrison, and that's when I like genuinely realized I have a passion for medicine over there. So yeah, that was about it. And apart from that, like like being in BMC, that is a very competitive environment. Like you're surrounded by 250 of the best from Karnataka. So being in such a this thing, I realized, what? I'm a I'm a medic over here, but so are all other 249 other people over here. So, what is it that makes me different from all these other people who are here? And that is something that, led to me tapping into a lot of my extracurriculars and all of that. And I think Vaibhav also knows. And I think, so yeah, I also I devote a lot of time to my extracurriculars as well. In my free time, I do a lot of research and reading with regards to history, and then I play a lot of badminton, and I'm into musical instruments as well. And so, yeah, apart from that, yeah, I always, try to make time for all these extra things. For instance, in my third year, because third year is, more relatively relaxed period in our MBBS, right? So that's when I decided to also do a diploma course in journalism at that time. And, there are people who might say, why do you do all of this? And don't you feel like you already have so much to read? Why do you have to do this also? But for me, sort of my answer to this is it's I don't see it as something that exhausts me. I feel it's something that, sort of re-energizes me. Like for each of us, we have our own thing. You're into volleyball, right? You don't feel like it is something that tires you out. It refreshes you and it gives you that break from your studies that you need, right? So in the end, like, yeah. So like for me, balancing my extracurriculars and my curriculars throughout my MBBS is like, a very special part of my journey for me.
Okay, one question: is it important to study from standard textbooks?
Yeah, actually, yes, I would say like because like for me in first year, I mean, I went with your usual like your Vishram Singh and say in physiology I read Indu Khurana and biochemistry I used Vasudevan. So it's like for me, it's like I pretty much used all those standard and usual textbooks and not like those last minute revision books that people tend to use. Like for biochem, we have Prasad, right, which is obviously a life hack for biochem,
Hmm.
and it will help you get everything, but it doesn't leave you very appreciative of the subject. Like for me, when reading Vasudevan, I sort of really enjoyed those clinical scenarios at the end of each chapter, and that's what has sort of helped me like the subject as well. And in general, I sort of stuck to Indian authors largely, but I think like in first year I briefly read a bit of Guyton as well, and I sort of realized I'm like, oh, okay, there's a lot more to like when you're reading a foreign author, you tend to appreciate concepts much better rather than purely reading it for an exam sake. And the only other time I did that was say in my final year when I decided to pick up Harrison and Bailey, and that's when I really got mind blown by the world of medicine, and that's when I realized, okay, yeah, this is what I want to get into.
Neeraj, when did you start preparing for NEET PG actually, and what platforms did you use for that?
Huh. So yeah, this is where I have to like be a little thankful for my seniors as well, because like whenever we're about to like start something, right? We always need a bit of advice from those who are like one step ahead of us. So I had the privilege of having good seniors who emphasized on the importance of starting early. And like, with regards to choosing platforms and all, they were a little helpful in that regards with telling me what are the advantages and disadvantages of each option. So for me, in that sense, I sort of decided, and by third year itself, I'd sort of commenced my prep that time itself, and I realized I wanted an offline option because I prefer being around people all the time, like like rather than just looking into my phone and preparing like online. I preferred the whole offline option, and like live classes, because when when you're around people and when everything is happening real time and there's no pausing, you have to stay alert. So I found that more efficient. So by that, because of that, like, yeah, so because I started attending offline classes from third year. By the time I finished my final year, almost I had consolidated my notes for roughly around say 60% of my subjects. Let's say maybe for maybe around 10 subjects, I had notes that was already ready and done. So that let me plan things accordingly for my internship. And with regards to platform, and like I said, because I wanted that offline and live classes option, I chose DAMS because like, we studied at BMC, right? So the thing about DAMS was they used to regularly conduct classes in the BMC auditorium back then. So that was a added bonus for us. And there were, other batchmates also taking that. So there was, that thing that, okay, our batchmates also will be along with us. So that was sort of helpful for me.
Okay, like, and coming to this MCQ solving and GTs, when did you start giving GTs and solving MCQs?
Huh. So yeah, that's a very good question. So yeah, if you are someone who is in final year or not yet in your internship, my main advice to you would be don't think too much about GTs or MCQs yet. Your main priority, and I'm telling like, because this is what I did, maybe it might work for you differently, but what I did was like till final year, what I did was I consolidated and kept most of my notes ready. So because I had done most of that, I saved like most of my internship was dedicated towards solving only your question banks, PYQs, and GTs. Because like like if you like your solving, I mean like keeping your notes ready is the foundation of your preparation. So if that is strong, solving your Q banks is based on that. So it's like if your foundation itself is strong, it gives you something like to begin working on your Q banks. So that's why like once internship started, I was able to like like I was just going on solving Q banks largely, and if it was only something very specific that I needed to like go back and read, or if it was some subject that I wasn't able to touch, I would read that topic that time. Otherwise, like most of my solving of Q-banks and giving of GTs was only during internship. And speaking about GTs, it is very important, right? Because it simulates that real exam experience, and it gives you a rough indicator of where you stand with regards to your own preparation. Like you're not supposed to look at one GT alone in isolation. Like look at where you've started and look at where you reach. That will serve as a real-time tracker of your own progress, and that I feel is more important. And many people, they're always afraid of giving GTs because they feel they're not ready. Because they'll be like, no, I've done only 10 subjects, I've done only 11 subjects, I've not touched these subjects at all, I'm not ready to give GTs. But don't think about it that much. At the end, if you finished your final year, you are familiar with all 19 subjects. Andre, you would have at least heard of those terms, right? It's not like you're hearing something entirely new for the first time. So it's fine. Just give those GTs, and like in the process, also you learn like as you're solving more. Like suppose you've not read ENT at all, like even like say like from ENT, how many questions? Maybe 5 questions will come. Seeing those questions, something from your third year might flash in your mind. And it's like even suppose if you get them wrong, you will remember, because you while you're reviewing that, you will look at the explanation and all of that, and that way you will remember from those mistakes. That way you won't repeat those mistakes again, and that is something that is more important when it comes to your GTs. So with regards to how many GTs to give, like for me, like my senior had set a target of 50, which is how much he was able to give in his internship. Unfortunately, I wasn't able to reach that much, but I was able to give around 30 GTs throughout the course of my internship. And so don't fret too much about whether you're getting only 100 correct in the start or 80 correct in the start. Just keep going on, keep going ahead. Like give them at say a frequency of 1 month apart in the start. Like if you're in your internship, I think you should be able to give say one GT a month, because like say there will be days when there won't be that much work and you will be able to leave early, and you will also have that one CL a month also. So do something productive if you are serious about cracking NEET in your internship attempt. So yeah, with regards to GT, this would largely be my advice, because like There's it one thing, it lets you know where you stand with regards to your preparation, and it serves as a tracker and as a rough indicator of how ready you are. And the second thing is like the mistakes you make in a GT, you are less likely to repeat them again because you've got it wrong. So you will be like, no, I should not get such a thing wrong again. And the other thing is like solving more and more GTs, you develop that MCQ based approach, which is important to crack an exam like NEET PG. Like, say for me, like over time, like solving more Q banks and more GTs, eventually, like it reached a point wherein you look at a question, you'll immediately rule out two options on the spot. And that is not something you develop immediately. It is something that you develop with time and with constant practice. Because I don't know, like this is something Rakesh Nair as well mentions, right? MCQ solving is not a science, it is an
Mm.
art. So yeah, that is something you develop with practice. So that's why giving more and more is important.
Okay, could you just tell us what was your first GT score and what was your last GT score before the NEET exam?
So yeah, the first GT that I gave was I think around I got around maybe 110 correct, and I think I gave my first GT when I was say roughly 2 or 3 months into my internship, and from there I sort of like kept building up. There'll be times when your GT scores stagnate. Also, you might like after a few you'll feel like maybe for 4 or 5 GTs in a row you'll feel you're stuck at one place and you'll be like, what is happening? Like, is am I not going to crack this exam and all of that? It's a very natural thing to happen. You don't have to freak out too much. Just keep giving your best shot and keep going ahead. The progress will eventually be visible. As for the last GT, this is a bit of a scary thing for me to say because I had given one GT 2 weeks before NEET in dams, and that mock GT I ended up getting around 170 correct 2 weeks before NEET. But then the thing is, I had decided to stop over there. But then for some reason, I felt no, I can't. No, let's give one more. So I made the stupid mistake of giving another GT with I think less than a week left, and I don't know, that one ended up going a bit haywire and all of that. So in that, I think I got some. So it's like suddenly from 170, I went to 140 in my final GT. So I was like really freaked out at that point, as you can imagine. So I was like, is my preparation good enough? And like, shit, like, what if that 170 was a fluke and all of that? So I had a couple of friends to calm me down and reassure me, like, you know what, it's just one this thing. You anyway, like now you got one. You've made a mistake here. You definitely won't repeat that now in main NEET exam. So yeah, all worked out good for
I
the
guess
best in the end.
I guess Ketan told me about this. I guess he used to solve GTs with you.
Yeah, yeah,
Okay.
yeah.
So one more question is it important to review GTs? And if yes, like how they should review GTs, like those who are giving?
Yeah, again, like this is where I would say, like say, I would say like when you're giving a GT, keep that whole day for the GT itself, because like giving a GT itself takes 3.5 hours of your time, right? And it's like after that your mind gets all refractory and all of that. You can't do anything for a long time after you've given a GT because it's a very taxing this thing. So since you've just given it and those questions are a bit fresh in your mind, review it and finish it in the same day itself. That is my main advice, and don't give too much time for it as well. Like say you're if you're giving your GT in 3.5 hours, I would say keep 4 to 4.5 hours maximum for reviewing a GT. Don't give too much time more than that. Otherwise, you're like it's you're spending more time on it also, and it's like you're carrying it forward to the next day, and then you might end up postponing it because of other work that you have and all of that. So try to finish the review in the same day itself, and try to like be compact and like try to be more efficient when you're reviewing your GTs. Like uh, like say when you're reviewing a question, if it's something you've gotten right and you know what the concept is also, don't spend too much time in reviewing that question. A question you've got wrong or you've left, spend more time on that question. Or if it's something you've got right but you got right by luck, then focus on that as well. So it's like compartmentalize, like what in reviewing what requires more time and what requires lesser time. And I know, like with regards to say Marrow, I know like each question has a lot of explanation. So in that, just look like again, like think if it's a concept that you're familiar with, you know almost everything in that concept. Just look at whatever keywords are there. See if everything sounds familiar to you and you know everything. Just go to the next thing. If it is something you're completely unfamiliar with and you've never heard of such a question before, or if it's a topic you don't know about, then like give a bit more time to that question. So yeah.
Okay. And coming to your internship, like how did you balance those duties and your preparation? How did you manage all that?
So yeah, for me, because thankfully I had most of my notes and I'd attended most of my classes during third and final year, I was able to devote most of my internship for solving and exhausting all my Q banks during that time. So that is something that I like largely did. And if it was something like, and I worked largely department wise. So it's like, suppose if I was posted in OBG wards and OBG labor room, I would focus on finishing OBG during that time itself, because it's like that way you're like reading about that this thing also, what you're reading, like what you're reading or solving like during that time, like related to that subject, it might help you while you're working there also
Hmm.
simultaneously at the same time. Like because like say if you're reading something like with regards to say preeclampsia or like gestational diabetes, these are very like real scenarios. You will see these cases in the labor room, right? So it's like when
Yes.
you're reading and revising those things and when you're solving Q banks related to that, it will help you when you're working there at the same time. So it's like the two sort of reinforce each other.
Hmm.
What you're doing in your internship will help with regards to your NEET preparation. Like say, suppose while you're breaking all those MagSelf files to load for all those Pritchard or Zuspan regiments, you will remember that dose also at the same time, and that will help you with solving your Q banks. And whatever knowledge you're picking up while solving your like while reading and solving, that again will help you with applying to patients that you see in your wards as well. So it's a positive feedback loop in that sense. So in that sense, like department wise, I was able to do a lot of things. Like during OBG, I did OBG. During medicine, I was able to do medicine. And like say when you're in PSM, that's when you get most of your free time, right? And I don't think you require 3 months to study PSM and solve PSM alone that time. So that's when you can go back to your first, second, and third year subjects during that time. So figure out an ideal timetable that might work for you and like divide work. So the most efficient way for me to go about was to solve solve or read something that in that particular department that I was posted in. That way it was more efficient. Like say if you're in surgery, it doesn't make too much sense reading OBG that time and leaving surgery for another time,
Yes.
right? And yeah, and managing time also is more important in this regard. Like if you're in medicine, it's not possible for you to study say 4 or 5 hours a day, right? So it's like making the most of whatever free time you have. For me, because I was a localite and I had to travel all the way from home, I made use of whatever time I had in the metro when I was traveling. Like when I was sitting in the metro, it's like the what a normal person would have done would be to just scroll through Instagram or just listen to music and relax a bit. But for me, like I realized I'm like, this is precious time. And so yeah, this is not something I would advise for everyone, but yeah, again, it depends on what works for you and what doesn't. For me, like during that travel time, it gave me that 1.5 hour of I was able to solve MCQs during that 1.5 hour of travel. And it's like, that little bit of free time you get here and there, try to make the most of it. Because it's not like say during a pre-duty, you'll be relatively more free. You can sit and do something that time if you're all done with your ward work and if you're just sitting and you're more relaxed. So yeah, time management is key when it comes to balancing your internship as well as your NEET PG preparation.
Okay, as you told, doing department wise, like studying department wise, is very important because if you're studying related to that particular department, the PGs or professors will help you out if you have any doubts or something. So in
Yeah,
that
yeah, yeah,
way, it is
exactly.
very helpful to do that.
Yeah. So if you're
And
suppose if you're sitting with them like when they're free and you're solving MCQs over there, suppose you get some doubt, you can just show it to them and like they can throw a bit of their
yeah,
insight also.
yes. And one more question, like, does internship duty, like while doing duty, whatever you see and whatever you see, whatever you learn from duties, will it help in your NEET entrance exams or any other entrance exams?
Yeah, definitely. Because in the end, it's knowledge is knowledge, right? And so it's like whatever you're doing, that is the real life application of whatever you're reading. So it's like I mentioned, right? Like something like a very real life scenario, something that can again show up in an MCQ.
Hmm.
Like when you're doing a lumbar puncture, right? You have to know which space you have to give in and like the layers that you have to go past. So all that, like you'll have to know the theoretical concept, and when you're doing it again, you'll remember, okay, I have to give it. It has to go between second and like it has to go between L2 and L3. Or like say when you're doing ICD, you'll have to like know the boundaries and you have to roughly know where you have to insert, right? All these again are questions that show up in your NEET also. So it's like whatever you're learning, it will help it whatever you're like reading in the course of your preparation. That again is something you will apply in a real life scenario also. And what you're doing also, it can be something as trivial as knowing dosages and all of that. That also is again a potential MCQ. So don't look at what ward work you're doing and what preparation you're doing in isolation. Look at it as something like each case that you see, each procedure you're doing, that is also something that you can learn from, and that is also something that can help you not just like solving MCQs, but become a better doctor also, right? At the same time.
So don't just think internship as just a clerical work. if you see it as an opportunity, you will definitely learn from it.
Yeah,
Okay.
I mean, it is clerical work, let's be honest, but it's like it's 80% clerical work, but the 20% of productive work that we do makes that 80% acceptable. Or okay, I'm like, okay, fine. I don't mind doing that much because I'm getting to do this much at the same time.
Yes. And one thing is like in casualty we manage so many cases, and those emergency procedures and emergency management protocols, whatever we learn there, that things are directly asked in the exam, so we don't have to study
Exactly.
those things separately.
Yeah,
Involuntarily
like
we
look at
learn that.
something like managing diabetic ketoacidosis. It's a very important question in NEET PG, and it's like a very like important like it's something that you like it's a real emergency that comes in casualty, right? That way you know, like okay, first the NS has to go, and like the ABG is very important, interpreting it, all of that. So it's like all those are like it's helpful with regards to both, with regards to your preparation as well as handling such cases when they come to you in casualty. So yeah.
Yeah. Okay, Neeraj, what advice you would like to give your juniors, those who are preparing in their internship?
So yeah, my advice is like because it depends. So it's like if you're the type who's giving your internship and you are serious about cracking NEET PG in your first attempt, my advice would be like make the most of your time. And so yeah, like time management, discipline is of key over here, because like if you want to like repeat and then crack, fine, well and good, that's your personal decision, nothing against you. But if you're serious about cracking it in your first attempt, you need to be get serious about it, and you need to realize that there are certain sacrifices that have to be made. And again, I'm not saying you have to like completely leave everything and not have any fun at all. We all had our share of fun also in internship. We all got to go out in all our with our PGs, and we went out partying and for dinners with them also. We also made time for sports now and then. Like I myself, like I mentioned, I'm into researching a lot of history, right? I was able to make time for that also, like during the first, say, 6, 7 months, and I was able to do a couple of heritage walks, which is something that I specialize in doing as well. So I was able to make time for the things I loved also. So it's not like it's not all gloomy, and it's not all just working yourself out and all of that. You will, provided you have that discipline and you know when to do what, you will have an enjoyable internship, as well as you will be able to focus and give a serious first attempt during your internship as well. And yeah, your revision notes matter as well, right? Like because everyone talks about DVT and BTR and all of that, right? Whatnot. So that also is important. So it's like for now, if you've just entered your internship and you've say if you're a bit familiar with all your notes, then only if you're familiar with all your notes, I would say you can go to the next step and go for those revision notes. But I would say revision notes again is something that works, and you'll be able to retain that information better if your foundation is strong. Like if your main notes are good and if you have been through everything, then it will be easier for you to remember those revision notes better, because those are like very concise, and those notes are made based on the assumption that you're familiar with concepts already.
Mm.
So it's like if you're familiar with your main notes, those revision notes will be much easier for you. So if you're like my advice to you would be not to jump into those directly. First be familiar with your concepts and then dive into those.
So if you don't
So
have
yeah.
those basic concepts, like you don't have to, like you should not go to those revision notes only, it doesn't make
No,
sense.
yeah, I mean, like say maybe it depends. Maybe it might work for someone else, but it'll be tough for you to remember, right? Because there's
Mm.
so much. There's 19 subjects at the end of it. You will. So it's like all these are very volatile. For me also, like in every reading, it felt like despite reading the same thing again and again, it felt like I was forgetting it, despite being familiar with my concepts. So it's like if your fundamentals are not too strong, you will forget it pretty easily. So yeah, like try to get your stuff ready before you jump into those revision notes. Would be my key takeaway.
One last question, Neeraj, which branch you are interested in for your post graduation?
So yeah, I think I sort of gave that away a bit during my initial this thing. But for me, it's like I was always trying to figure out what, like till my final year, I was not sure what I liked. But then, like during medicine postings, I thankfully had the privilege of being in a wonderful department and with like some amazing professors. Like say we had Ravi sir, who was the head of department back then and the dean back then. So like having people like them really like inspired me to get into medicine. So yeah, we had a lot of amazing profs back then. So reading that, and like when I opened Harrison for the first time and when I was reading certain things about it, I was like, whoa, okay, so this is something that's really good. The thrill of, like trying to, because in the end, medicine is detective work, right? You're looking at what clues you have in front of you, and you're trying to come to a diagnosis. So for me, the thrill of coming to a diagnosis and managing a patient was something that I enjoyed. So yeah, for me, naturally, I realized like, yeah, medicine is something that I like to do. And during internship as well, despite medicine being relatively among those more tougher and more hectic departments to work in during your internship, I, like, although like there was a lot of staying back late and all of that, I was still, sort of enjoying the whole process. So, I realized, this is what I want to do. So it sort of hit me over there. So yeah, hopefully all goes good. And yeah,
If I get BMC, we'll be colleagues there.
yeah, exactly. So hope to see you on the same side of casualty.
Okay. Thank you so much for taking up this interview, Neeraj. So, especially, it will be helpful for those who wanted to meet you in person and ask your advice for their NEET PG preparation. It will be helpful for them. I'll make sure it will reach them.
Yeah.
Thank you so much.
And yeah, so if I'm always ready to help out those who need a bit of help or advice with regards to their preparation. I think you can reach me or Vaibhav for that regards on Instagram, or you can, like, just drop a comment on Vaibhav's video and he'll help you out.
I'll share your number or Instagram account ID.
Not number, not number. Yeah.
Okay.
But yeah, thank you very much.
Thank you, Neeraj.